Hi, this is PA from the Balance Neuro Clinic, and I want to talk to you about the Movement 101 course to give you a sense of what it is, what it entails, what to expect, and who it's for. So, Movement 101 is basically all around the foundations of movement. So, it's nothing particularly flashy, there's no handstands, no acrobatics, which might not sound great, but maybe sounds reassuring. The idea is that it's giving you the tools and principles you need to maneuver your own body, make sense of your aches and pains, and make some changes. It's principle based, so it's something you can apply to everything, and we're essentially working joint by joint, understanding what joints do, how to keep them healthy, what they should be able to do, how to restore what they can't do, and then tying it all together, understanding the relationships from head to toe, how the big foot influences the hip and so on, and going into detail in terms of that and feeling it and feeling the benefits of that. So we work initially with the breath, we work with the spine and spinal mechanics and how breathing influences that. I place a huge emphasis on breathing because it's our easiest way of influencing the brain and dropping stress and making the brain feel safe. And if the brain isn't on board with what you're doing movement-wise, then you're not really going to see many benefits or see many improvements. So I really go after the importance of breathing, and particularly in the first 3 days, and really understanding the mechanics of the breathing and how we can create good quality breathing that creates positive changes in the body. And then with that baseline, we then explore the hips, knees and feet, and onto shoulders, elbows and wrists, the neck, the head, the jaw, and understanding how all of these different joints move, and how you can, if you have an ankle injury or if you have ankle pain or back pain or whatever, you can take these skills and kind of establish a baseline of where you are, what you can do against what you should be able to do, and then principles and methods that will bring you towards what you should be able to do, and in turn reduce pain. So you're learning all of these principles, you're applying them to your own body. Because it's a small class, it's no more than 4 people, we can kind of tailor things a bit. We can, what I tend to do is at the start is I'll ask if anyone has specific concerns, specific injuries that they kind of want to have addressed. So while we might be, so they might come in with a shoulder issue, towards the start we're going to be working towards the lower body, so we might be working on the ankle, but we're always going to be trying to tie it back to what they're dealing with, to give them a broader sense of how the entire body is working, and they can begin to appreciate that and feel the difference. And then eventually we obviously get to the shoulder specifically, but we do tend to give individual attention and tie things into what you're actually dealing with, so real world things. So I suppose this brings us on to who the course is for. It's really for anyone. My whole idea with it was that I primarily do private treatments for chronic pain, so that's hands-on physical therapy, neurology, that sort of thing. And one of the biggest things I find is that it's trying to find a balance between doing the treatments and giving you the hands-on interventions that you might need, but then also teaching you the movements and the skills and giving you the understanding that you need to keep making the changes in your own time. And a lot of times what I find is that many pains, many sort of, nothing that's necessarily hugely severe, but stuff that kind of persists and never seems to go away, is that when you have better movement skills and a better understanding of how your body works, a lot of these things kind of take care of themselves. So the whole idea with the Balance Neuro Clinic was that I'm offering a full, sort of a complete solution. So you come in, you might have really severe pain and we can do some hands-on treatment, private sessions, but then maybe you're managing your pain. There's still a bit, but maybe your movement capabilities aren't quite there yet. So the movement course offers a more affordable, more practical approach to teaching you these skills over time at a nice regular pace in a fun kind of informal environment with a group of other people. So it's really for anyone, regardless of age, regardless of fitness levels, regardless of gender, regardless of anything, because these really are the foundations of movement. It's not about preparing you for specifically for the rugby field as opposed to anything else, or specifically for this sport as opposed to anything else. It's these skills will help you do your shopping better, carrying heavy bags. They'll help you pick up your kids from the ground better. They'll help you get up off the ground better. You're less likely to fall, which is a huge predictor of mortality. So you'll be healthier overall. But they'll also help you deal with whatever specific sport you're doing, whether it's some sort of martial art, whether it's rugby, football, swimming, whatever it is, because you will understand your joints better. For one, you'll understand how those joints integrate into the entire body, and most importantly, you'll understand how you can actually change them and improve them. So it really is for everyone, regardless of anything. Once you're able to show up, to walk up to the class and be roughly comfortable for an hour. I mean, if you're in severe pain, then again, that's why I offer the private treatment. So it is sort of a complete solution. Beyond our sort of joint by joint approach, we're then tying things in together with roughly the anatomy and motion approach is something I use quite a lot. It's not purely anatomy and motion, but it takes from that hugely. And this is what's going to help you understand the connections from head to toe, to understand why maybe that old ankle sprain is significant to your current shoulder pain and so on, or why you need to be able to breathe properly to resolve your back pain, or why you need to be solidly grounded through your feet to resolve the hip, or whatever it is. The sort of final 4 classes, when we're tying things in together and tying the entire body together, is going to give you a sense of that, going to give you an understanding of how the body actually moves in reality, not just in your day-to-day, but when you're walking down the street, when you're doing anything, the way humans are supposed to move. So that roughly encompasses everything. If you're interested in the course but you're not sure you're ready, you're not sure if you maybe need private treatment versus the course, or maybe you're hoping that you could get away with just doing the course because it is more cost effective and it will give you more tools. These things I do teach in my private clinic, but it's entirely based on this in the course. So if you have any questions, by all means get in touch. I'll have a link below if you want to book your place. Courses are running every 2 months roughly, so they run on 7 weeks, 2 classes a week, 1 hour per class. I'll always stay back after class if you want to have a chat, if you have any questions outside of the strict format that we're following. So it's a very informal environment. We're going to go through a lot. There'll be some games. We'll try and kind of help you understand things in the context of more fun things, so that you're not, it's not necessarily about scientific knowledge of the range of motion of the ankle. It's trying to make it fun, trying to make it relatable, and trying to make it specific to you. So it's informal, it's a small group environment, plenty of attention to detail, and it's absolutely for everyone. So any questions, let me know. If you're unsure about anything, let me know. If you know someone who might enjoy the course, please share this with them. Please pass on any information. And yeah, do get in touch, and I hope to see you at the course. Thanks.